With health worldwide, an estimated 19.3 million new cancer cases were diagnosed in 2020. November is Pancreatic Cancer Month. It's seldom detected as its early stages when it's most curable. And we're joined by Consultant General Surgeon Dr. Walid Faraj from Clemenceau Medical Center Hospital, Dubai. Thanks so much for joining us tonight, Dr. Faraj. Now, what role does the pancreas play in our bodies, and what is the impact of a pancreatic cancer in particular?
Thank you, Ramya. The pancreas is an organ in the body which is located between the stomach and the spine. It's a very important organ. It has mainly two main functions. It has like an endocrine function where we all know about the insulin. It's secreted by the pancreas and other hormones like glucagon and other things. And it has also an important role where it secretes certain enzymes which are important for digestion of the food and all this. Unfortunately, pancreatic cancer can happen, and there are many types of pancreatic cancer. The most common, which is more than 90%, is really a bad pancreatic cancer. It's called the adenocarcinoma. The problem is that those cancer, the overall survival is really low. I mean, even with all the technology of treatment, the new chemotherapy and all the advancement in treatment, still 5-year survival is around 10 to 15. The 5-year survival is 10 to 15%.
So people who suffer from pancreatic cancer, 90% of them have a 5 to 10-year survival rate.
Yeah.
So who is at high risk of developing pancreatic cancer, and how can we prevent it from developing?
So people who are high risk, basically age is one of the risk. Anyone who is above 45 to 50 years is at high risk. Most of the pancreatic cancer occur, up to 70% for people who are more than 65. It's not common in young population. People who are obese, they are also have association with pancreatic cancer. Alcohol consumption, which causes pancreatitis, which means that there is a recurrent inflammation of the pancreas. This can cause increased risk of pancreatic cancer. Genetics, unfortunately, is also a risk factor. And other also important is the recurrent infection of the pancreas from any other sources.
So pancreatic cancer, it often doesn't have clear symptoms as it spreads to surrounding organs, and this is one of the main reasons why it's so fatal. What should people look out for in terms of symptoms?
So unfortunately, sometimes when any patient presents with pancreatic cancer, it is too late. As you have just mentioned, it could have been spread to other organs like the liver, the lung, and other organs. So any patient who might have like a sudden onset of diabetes, this is one of the signs. A sudden onset of back pain, even taking painkiller, but the pain is still there. Sometimes people get jaundice, which is like the yellow discoloration of the eyes. If you have any change in the urine color, the stool color, these are all signs of could be some obstruction related to pancreatic cancers. So it's very important to know about these symptoms and to report directly to the physician.
And just finally, are there any advancements in treatments for pancreatic cancer? You said that the current treatments aren't necessarily very successful.
So basically, there has been a lot of advancement compared to the previous year. We at Clemenceau Medical Center in Dubai, we have adopted a multidisciplinary approach to any patient who comes. So we'll get the patient, we'll check what is best for him, to start him, for example, on chemotherapy first, then do surgery, or just do surgery. It depends on the stage of the cancer. And we have advancement in the treatment, in the surgical treatment. So we have the robotic surgery, which is now the new era of all the surgical approaches. We have the laparoscopy, and we have the traditional open surgery. And there have been a lot of progress in this field, and the advancement has made the survival better compared to previous years.
We certainly hope to continue to see better survival rates. Dr. Walid Faraj from Clemenceau Medical Center Hospital, Dubai, thanks so much for joining us.
Thank you.